So I want to introduce you to somebody. It's my Aunt Jeannie. She has been a nurse for 35 years, I learned during this call, as long as I can remember. And she's been a traveling nurse, so she's got to live in some really cool places. New Orleans, I remember going to visit her when I was a kid. North Carolina, she's been all over. So recently, she was in New Jersey for a little bit of time on the front lines, helping people that have been diagnosed with COVID-19 and that actually had the disease. And I wanted to talk with her because she's really the only person I know who's been that involved with this. A handful of our clients have been affected by the virus, either directly or their family members. But I wanted to get some input from her on what our office should be doing when we go back to work in a couple of weeks. What precautions should we be taking? What things should we be looking out for? So I gave her very little notice. I sent her a text message. I said, join me at 9 a.m. tomorrow for a Zoom call. I was hoping to get it done in about 10 minutes. We went a little bit over. So you'll see at the end of the video some of the people from our team hopping on for our 9:15 popcorn meeting that we have every day. So if you want to know some of the things that you may want to be doing in your workplace as we go back to the green phase or get back to work, listen to Aunt Jeannie and see what she has to say. And hopefully this helps you out a little bit.
Okay.
All right.
All right.
So I get in a lot of trouble in my office because I have really great ideas. And my team says, can you give us a little more notice before you do things?
Okay.
And no, I can't. So I did the same thing to you. I texted you last night and said, can you hop on a Zoom call this morning?
Yes.
Because I had a really great idea. So how long have you been a nurse?
35 years.
35 years?
Yes.
And you were in New Jersey recently?
Yes.
Tell me what you were doing there.
I went to Paterson, New Jersey to help on the front lines of the COVID crisis up there. They were extremely short-staffed, and I went to help in a COVID ICU.
And where do you live normally? Like, you're not from New Jersey, right?
Right. I live in Myrtle Beach, South Carolina.
Okay. And how long were you there?
I was there for 5 weeks.
Okay. So here's what I wanted to do. I have spent a lot of time studying like the business impacts of this disease and the pandemic or crisis or whatever you want to call it. I know absolutely nothing about the disease itself or the virus or whatever it's called. And I thought it would be helpful for our office if I had somebody from the front lines explain what we should be doing, what we should be worrying about. And it's also something I think that we can share with our clients who, they're running businesses, they're busy doing other things. They probably don't know an awful lot about this.
Right.
So tell me, when we open our office back up in the next week and a half or 2 weeks, like what sort of things should we be doing?
Well, you definitely want to have a place where you can wash your hands. That's probably number one, is hand washing.
We can do that.
Yeah. Well, people think wearing gloves is the way to go, but I just feel like there's COVID on gloves. When you see people wearing gloves, avoid those people because they're the ones that aren't washing their hands. They're just wearing gloves thinking that that's going to be a magic, protectant against the virus.
Right.
So hand washing definitely, if people have symptoms or a fever, you shouldn't be coming to work.
Do you know how long that is? Like if I had a fever 4 days ago, like how long should I be isolating myself?
It's really 14 days because what I've seen working with it is the virus, you can have symptoms on day 2, day 7, day 9. Really, what I've seen is the virus is the worst on day 5 or 6. That's when people really become more critically ill if they have it and are gonna, have complications from it. It's day 5 or 6. So you may not have symptoms for a couple of days, and then you get really sick, or you don't. Some people can have the virus and just, have mild symptoms and be fine. But 14 days really is the key.
Did you see any patterns? Like, does this affect men more than women, older people more than younger people? Like, are there particular groups that should be worried?
So I happen to be in Paterson, New Jersey, that is kind of a melting pot. In that specific area, there were a lot of Hispanics and African Americans, and definitely the Hispanics in that area were more affected. And I think it was more because there were multiple people living in the house. So if one person got sick, then the next person, the next family member was sick. But I also saw one of my patients was 38 years old with no past medical history. I also knew of a marathon runner who was in his 20s that became very ill. And you don't have to have an underlying condition to be affected by it.
So let's go back to the precautions. Hand washing, absolute number one, top of the list thing. What other things should we be doing?
Definitely the social distancing. I would, if you can be 6 feet apart, definitely do that. Wearing a mask is not only to protect yourself, but to protect others, because you may have it and may not be symptomatic yet. So the thing about the masks is you don't want to wear the same mask day after day after day. You want to wear it for one day. If you have a fabric mask, you want to wear it for that one day and then wash it. So I saw, yesterday someone had masks in their car hanging on the rearview mirror. No, those are disposable and they should be thrown out, because you could have COVID on the inside of your mask. You're breathing in those droplets, and then you're taking it off and putting that same dirty mask back on. And even mask removal, you want to take it from the outside. Don't touch the inside of the mask. Wash your hands.
Kind of makes sense.
Mm-hmm.
So disposable masks, one use, throw them out. But the fabric, we've got custom masks with our logo and stuff on them. You're saying wear it for a day and then wash it.
Yes.
Any, like, just regular wash cycle?
Yeah, regular wash cycle is fine.
What about, I've seen people with face shields, or all these stores we're going to have these giant plexiglass walls that they put in. No?
I think the mask is what's most important, because this is where it's spread from, the nose and mouth. And definitely the hand washing, like I talked about, because there's some controversy whether it can be transmitted from surfaces. So you definitely want to, at your desk, clean your desk after every day, because you don't know if you have it one day, just always keeping your surfaces
so
clean.
That's one thing that we've tried to do. We have a lot of people, not a lot of people, but a number of people coming into the office for like real estate closings, and we've changed our process, and everybody in Erie County has changed the process that the buyers sell at or sign at one office, the sellers sign at another office, which is really nice. But after they leave, we've been wiping down everything: tables, chairs, door handles, pens. I mean, everything they come into contact with.
Yeah. I mean, in my situation in the ICU, it was all about the airflow. So we had to be in a negative airflow room to prevent the droplets. And this was contaminated. I mean, everybody in the unit had COVID. All the patients had COVID. So in order to protect ourselves, we had to be in a special airflow room. So, we're walking into stores and wherever we're going, nobody has negative airflow in a public arena, right? So you got to wear the masks. You've got to wash your hands frequently. Whenever you think you've touched something, you should be washing your hands. We should always be doing that. I mean, I think if there's anything positive that's come out of it, it's that people are more aware that they need to wash their hands.
Yeah.
And I think that and stop wearing the gloves. I'm sorry, it drives me crazy. But, um,
So what about taking temperatures? I've seen a lot of places that want to buy thermometers. We've been looking at like phone sanitizers. So if somebody wants to come into the office, they can throw their keys and their phone in a little box and sanitize it.
yeah,
Any input on that stuff?
the UV sanitizers.
Yeah.
Yeah, they're awesome. We use those in the hospital. I've worked at a ton of different hospitals, and a lot of them don't have the UV disinfectant. But now more and more places are getting it, and it does work.
So let me ask you, I want to ask one final topic, and this is
Okay.
the worst one for me.
Yes.
So you were at our house a week or two ago,
Right.
and the first thing you did was you came up and hugged everybody in my family, even though you had
Right.
been treating these people for so long.
Yes.
And I know you self-isolated after all this. Did you get tested?
So I had the option of being tested, but I was asymptomatic, and the place where they offered the testing was in the COVID emergency department. So I would have had to have registered as a patient and waited in a potentially, well, there was COVID all around in New Jersey. So I decided not to expose myself there. I was very safe in the ICU where I worked. We had all of the PPE that is recommended. And yeah, we were very well protected there.
But
So
tell me what's involved in getting tested. Like, are you familiar with?
yeah, I had to test patients. So it is a deep nasal swab. So it's like a Q-tip that goes all the way up and back. So it's pretty far.
Does it like I just like does it touch your brain? That's just so.
Well, I mean, your sinuses do communicate with your brain. So when people say that, it's kind of like, yeah.
Okay.
But the thing is, this is where things get confusing. Is we're getting reports daily. I actually look at the Johns Hopkins website because I think that has the most information. But they're talking about how more and more people are affected or testing positive, but we have more testing now. So I think it's kind of skewing the results. Yeah. But also, we can be tested for antibodies, but there are so many false negatives with that that you don't even really know if you have the antibodies. So
I think there's still a lot of development to be done there.
Yeah, there is a lot of development. You're right. Cool. So I quarantined for 14 days and yeah, have had no symptoms, no fever. So I feel pretty confident that I was able to come out of there healthy.
Awesome.
Yeah.
All right.
So that's my Aunt Jeannie. Who knew she had such a distaste for gloves? But it doesn't sound like there's a lot of magic here. Wear your masks, have your team wear their masks, replace them or clean them as necessary, wash your hands, wipe down surfaces. We didn't really want to have one of those giant plexiglass walls set up in our receptionist area, nor does it sound that it's particularly necessary. So we're going to take some precautions. We're going to keep everybody safe in our office, both our team and our clients and anybody else who comes in. And hopefully this was able to give you a little bit of help too. So if you want some more information from us, you can always reach out at eriebusinesslaw.com. I look forward to hearing from you.